I got associated with the N.O.R.M.S nearly about 4-5 years back when my mother-in-law was down very, very sick, and you could say nearly on deathbed is what I could say. She had gone through a very major hormonal surgery and she was totally immovable on bed. And that's when we had to move her back home, and we got to hear about N.O.R.M.S through a very good friend of ours. And I must say today it's been a blessing to be associated with N.O.R.M.S because that person who was on the deathbed is moving around, walking around, and even traveling today, my mother-in-law. And the kind of help that we got with N.O.R.M.S was amazing because they were there for us 24 hours. That's exactly what you want when you have a patient at home. I mean, you want a doctor at call, you want sisters, nurses, everybody, and well-trained for any kind of emergency. Every day we had the doctors on call finding out what was happening. The sisters were there, like with every medication. They were very well trained to take care of whether it was injections or sudden oxygen or, BP fall or heartbeat rate, anything. So it was more like the best thing that you can give of course, younger people can, be in the hospital, but with elders, you really don't know how to handle them in the hospital. And that was the best thing that could happen because she was in the hospital, but very much at home. There actually came a time when my mother actually started sinking. And through N.O.R.M.S, before we could even get to any hospital, if there was anything, before we even called our doctors in the hospital, the doctor at N.O.R.M.S were at our place, suggesting what was the first treatment, because touch wood, they do have a good relationship with a lot of other doctors around the city. And so they would know what to do before even the main doctor who was associated with the patient would come into action. It was more like an emergency care at home. We put in the rice bale wire for my mother-in-law, which was a very difficult decision. And that was actually suggested first by the N.O.R.M.S doctor itself, which they, told us that it would really help her. We were very hesitant, but the way the doctor sat and explained the whole thing, that, how it could help us, it helped us make a decision at home, and we went in with it, and touch wood, that is one thing actually which really helped her get out of it, because it was getting very difficult for her to even drink liquids. That rice bale wire really helped her. That was thanks to the advice given by the doctors. We had the one sister who was supposed to do just a 12-hour duty. She would even do continuously for the next 24 hours. I mean, that's something which they never left us without a help or an aid, even though, we had a 12-hour shift. So that was very responsible is what I would say. That's the best thing that you can have when you have somebody taking care of a patient. And that helped me to continue going for my work and everything. It didn't stop me from living my everyday routine, because she was on bed for, you can say, nearly 1 year. And when I say on bed, she was on bed right from the time that she couldn't move to the left or right till she started walking and everything. So 1 year, it's not easy. You can't let your life stop, especially in today's time where everybody is working. So with their help and, with the kind of responsibility and with the kind of assurance that I got with the sisters from N.O.R.M.S, I could continue my everyday work and duty and my normal living. So that was a great help.